This is the Get Healthy 360 podcast, where we discuss topics related to your physical, mental, financial, and spiritual health. Your host is Dr. Chris Ferguson, board certified in anesthesiology and pain management. This podcast is for informational purposes only, and you should consult your primary healthcare provider before making any decisions related to your health. And here's your host, Dr. Chris Ferguson. Oh, one more thing before we start. If you like this episode, please consider rating us 5 stars. We would really appreciate it. Thanks very much.
Welcome to Get Healthy 360. Today we have with us Keith Javery, pain physician and anesthesiologist. He has been practicing for over 20 years. He's double board certified in anesthesiology and pain management. He's a diplomat of the American Academy of Anti-Aging Medicine. He's also a bench press champion. So what we're talking about today is keeping your physical health as you age. And a lot of people, as they age, will get pain. So who better to discuss this than a bench press champion and a pain physician? So Dr. Javery, thank you for joining us today.
Thanks, Chris. I think this is great. Love it.
Great. So let's get to know your background. Then we'll talk about how you pursued different sports over time. Then we'll get into your workout routine and then tips for powerlifting. Because I think the powerlifting definitely maintains your bone density, muscular strength, etc. And then we'll talk about anti-aging in its current state. So back at the beginning, where did you grow up? How did you decide to go into medicine?
Yeah, it's I grew up in where the climate is always great and the streets are always crowded down in Southeast Florida, in Hollywood, Fort Lauderdale. And although I was born in Ohio, my father, who was a physician, my father was an anesthesiologist, he's passed, but wanted to be in a warmer climate. So we moved down there when I was in 3rd grade. So essentially raised in South Florida, enjoyed the warm weather, that type of thing. That's all I knew. And why I went into medicine, to be honest with you, it was interesting. I think my father used reverse psychology. I would say, you know, Dad, I don't know what I want to do. I knew I liked to do this or like to do that. And he would say, well, if you want to do medicine, it's a long road and it's a hard, path, and et cetera, et cetera. And I think he knew my personality, like most physicians. I mean, we don't get to that point because we're, couch potatoes, or we just sit back, or we're lazy. It's a lot of commitment. And I want to think, although I didn't get a chance to ask him, he passed several years ago, that I believe, in fact, I'm fairly certain he wanted me to go that route, but he didn't want to tell him because like most sons, I wanted to please my father. And so he was an anesthesiologist, and I went to medical school, and on rotations, coincidentally or not, I found the OR just a wonderful place. I thought it was just the most cool, awesome place. I just loved it. I mean, I have to go on internal medicine rotations. It was okay, but I was like, anesthesiology. And then I remember rotation. It was in the pain clinic where I was at University of Kentucky. And my first rotation through, I loathed it. I couldn't stand it. I don't know. It was maybe you can relate with other anesthesiology residents. Pain clinic month, But then we had a month every year, and the second month, all it was a mentor change. And I'm going to give a shout out to Dr. George Coakley, well authored in obstetrical anesthesiology. Peer reviewed textbooks, etc. And George, who still I consider a good friend and mentor, long since retired, but he was attending the pain clinic those several months, and it flipped. And all that the difference was a mentor. And that plus I used to not always be a power lifter. I actually used to be a runner, and I ran long distance, the mile and the 2 mile in high school. And I had moderate success, nothing great, but moderate. And then I went to the University of Florida and then transferred to another school, the Division II school, which is now called Truman State University in Missouri. But I was a long distance runner, and I was right now I weigh 215 to just shy of 220. And then I remember 165 at most. Same height. I was 6'2". I used to tell people I'm almost 6'2" now as I age at 59, but I found it more difficult to run, only because, not that it was painful, but I was starting to fall behind no matter how much I trained, and switched to cycling. Had some very good success with that. I was able to get some sponsors, and I did that for several years, latter part of college and into medical school. On weekends, I somehow found the time to train and do some road cycling events with that. But then I had an accident in a road race called a criterium, and I fractured my pelvis, and I had a fracture, complete non-operative, thankfully, but non-displaced, but fracture that went all the way out from my pubic, from my acetabulum out my pubic and iliac ring. So complete fracture of my right pelvis. And so I did 6 months of my internship from wheelchair. I was non-weight bearing. And that's the first time I experienced, like, myself, long-term chronic pain, something that didn't hurt for just a few weeks. And I remember the orthopedic residents who was kind of helping me along, saying, it shouldn't hurt that much. And I thought, geez, I've always thought of myself as a good high pain tolerance. And every time I try to just a little bit, just to get some, they didn't even give me therapy back then. This was 89. I mean, they just, do you want to finish, or you're going to have to come back and do it again? I know I do not want to come back to my internship again. And so I remember someone told me, he said, you know what, there are doctors that do this their entire life because they are paraplegic. And I said, if they can do it, I can do this. They're in that chair for their life. And so I was able to get through my internship successfully. But I just remember the attitude and it can't hurt that much. And it was a bit of a, less than type of thing. And I remember actually feeling a bit of resentment. I knew what I was feeling, and I wasn't crazy. And I know it was a pretty bad fracture. Luckily, I did not need operative repair. But that sparked my interest. And then the other thing was that, and I think most anesthesiologists, and I think every pain specialist, I would think, especially from the anesthesia background, can tell you the famous, the interaction, the OR. I love the OR, except for the part, hey, anesthesia. And that bothered me. And because I, as part of the team, would help that surgery become a success. And I was just this figment of someone's blurry vision of the case. And I also enjoyed the best part of it. I really like talking to the patients in pre-op. That's the best time. And then I met George in the pain clinic. And then the rest, as far as my career was history, I was hooked. I loved it. I love being able to help people, but being able to talk to them before and after an ongoing relationship. And there were people now in my practice that have been with me for more than 25 years consecutively. And there are patients that are with me for several years and that pass because they're older. There are patients that are younger that are pass that were accidents or whatever. But I enjoy that because it's the interventional part. But I enjoy the fact that when patients come to me and they have these physiological problems, I actually can connect with them. I in a way, with my history, I understand, and they tell me they pick up on that. That's
I think it's interesting, as a pain doctor, you've actually experienced chronic pain yourself. So how does that influence your outlook on treating patients? And then to our topic that we're discussing today, longevity and preventing pain long term.
Yeah, and it's created both. I think it's an advantage, but it's also going to be a double-sided sword on that, because I'll sometimes catch myself being maybe less objective. And someone comes in and they have a chronic pain problem that, let's say I am trying to diagnose, or I have confirmed the diagnosis. Am I truly being as objective? I believe I am, but it's important for any physician to check themselves. I find myself necessary, check my, not motives, my motives are good, but check my objectivity. Is this something that is am I accurate, and is my treatment program appropriate? And so but I find it much more of an advantage than a disadvantage overall, because when I tell a patient, and like right now, bench pressing, I have had a kind of a brewing chronic rotator cuff tendinopathy, and which is common with anybody over the age of 50, as we all know, but it's very common in even young patients that are competitive bench press or competitive powerlifters. And so I can understand that. And when they say, gosh, whenever I turn over and it feels just aches and here, and I know exactly what that feels like. Or let's say they have something that I haven't had, although I have had back issues in the past. Everyone does. I've had injections. I've received them from partners and from pain specialists. And so I've been on the other side of that too. And not that that is a prerequisite for having, a solid practice and experience with the patient, but I find it more of an advantage than a disadvantage.
That's interesting. So you spoke about, you've done a variety of sports. You've done endurance sports, you've done powerlifting. And before we started recording, you've put up some really impressive numbers, especially for someone who's 59. So the general perception or common perception is as you get older, it's just understood you're going to get weaker over time. But being 59, it sounds like you're a lot stronger now as opposed to when you're, I'm sure, doing your endurance sports. So what's your approach, or what's your philosophy as far as aging? Like if you had to give advice to someone in, say, their 20s, 30s, 40s, 50s, what would it be?
That's a great question. It's a question that even not with interviews, but that I rarely get, or it's rarely talked about, but it's been talked more and more lately. Only because I'll just to give you my own personal reference. In my teens, I started running because I remember I was living at my aunt's and I was really frustrated. I was a teenager, and so I had that teenage angst or whatever. And she says, "Just run it off, run off." And I started running it, and she said that made me feel better. But as I started getting to that and transitioning to cycling, transitioning to lifting, I'm goal oriented. And most people that I enjoy being with are goal oriented. And if I could go back and I see myself 25 years old, and what do you want to do? Where do you want to go? Or patience? If only we had a time machine. But it is never too late. What would I tell? What do I tell both my patients and other people is when they say go low, go slow with like medication type of titration. And this is very hard for me. And I'm not saying I take my own advice, but I will tell you, I would advise those is to go low and have not only yearly goals, but annual, and then decade goals, at a time. Now, I don't know if I would have been 20 years old, I would have said, well, when I'm 40, I do remember this. Like a friend of mine who I compete and train with said, we're going to make sure we bench 10 times our age at least for each, at each year. So when we're 30, we're going to make sure we can at least hit 300. When we're 35, but that's an impossibility because obviously the curve falls off. And if I were to be able to lift 590 pounds in a bench press, not only would I best the world record in my age group by almost 100 pounds, it's just not physically possible. But what I would recommend is that pick not a sport, but an activity that will enhance your everyday activities. And what do we all do as humans? We all get in and out of bed. We all get on and off the toilet. I mean, as weird as that sounds, we all do certain, we call them activities of daily living, not just for fun, but we have to get in and out of the car. I mean, I see my patients sometimes when they roll up into the pain clinic, to the parking lot, it is an endeavor for these people to get in and out of their car. And you're saying, well, maybe that's just because their pain has been bad for the past year or two. But then when I talk with them, it's been getting worse and worse over the past, and then it's years. And while they could get out of the car 5 years ago or 10 years ago, and they now can't without somebody pulling them out, that didn't happen overnight. Rarely does it sometimes, but rarely that happens overnight. And rarely does training or does activities get you out of the problem overnight. But just the opposite is what I would tell a 20-year-old is that maintain a physical activity level, but it's more important, in my opinion, to maintain strength and flexibility as we get older versus endurance. And I know that's a very hot topic, but endurance, I've done endurance sports, but the extreme endurance sports, that's not as important, in my opinion, as it is to be able to go up and down stairs. You have to have cardiovascular shape, but unless you can literally engage your hip flexors and extensors equally, you're going to fall. And you have studies that if you fall after the age of, I think it's 60 or 65, there's about a 1 in 3 chance that you will not live to leave that hospital, or there'll be a death within that first 3 months. So it's from ancillary causes. And so what I tend to recommend is that pick something, one, that you really like, because some people loathe the gym. They can't stand it. And I'll be down here like in my gym. I built my house. This is kind of like my fortress of solitude. I dig it down here. I mean, I truly enjoy. Sometimes I'll come down here and just read my emails, and I don't know. I get, because I associate this with endorphins, maybe. But pick something that you enjoy, and don't. The problem that I have is don't try to get to the at a ward level or whatever. That'll come if it happens. But the main thing is something that will allow to age gracefully. And so I'm convinced that whether it be not necessarily powerlifting, but resistance training, movement of the entire body, whether it be with weights or with body weight, is absolutely the key to true health and vitality. I'll say that.
So you've addressed the question of endurance versus powerlifting. So clearly, you're in favor of powerlifting to help with strength of activities of daily living. Mm-hmm. What are your thoughts? It's interesting because as an endurance athlete, powerlifting athlete, and also a pain physician, so seeing injuries over time, what are your thoughts on CrossFit? Because the stereotype of CrossFit is it tends to injure people.
Yes, and that general thought is actually been shown. I mean, and I can't Bible and verse quote the studies, but I have looked at them, and I also just watch. And I'll give a negative on powerlifting in a second, competitive powerlifting, but CrossFit itself. If you look at who competes across us, just even look at this, non-scientific. Who's competing in powerlifting, like long-term? 20, 30, maybe 40 something. Usually it's 20 and 30 something. And okay, that's probably true in most sports. I grant you that. But CrossFit involves very explosive movements, like very quick movements with weight. Those two things, they don't go well together. Olympic lifting requires that, absolutely. And so they use a lot of the Olympic lifts during CrossFit, and they utilize various other exercises for competition to train for the Olympic lifts. Olympic lifting is only basically, technically 3, but really only 2 lifts, the Olympic lifts, and it requires an explosive type of movement, which is incredibly important. But I can tell you, it does produce a phenomenally higher injury rate. And I will tell you, both personally and professionally, I do not believe it is a way to maintain strength in the more masters athlete or anyone over the age of 45 or 50. I would say you're practically guaranteed a very severe injury, even doing everything correctly. And I can tell you, I've had this like a shoulder rotator cuff tendinopathy, and I am convinced that is probably from several years ago of improper benching technique, where it looks right, but it wasn't until I got some very expert help. But CrossFit, it's great.
I have to ask, what were you doing wrong with the bench press, and then what did you have to correct?
Yeah, it was so subtle when you first look at it. And I remember I was at one of my first competitions. One of the competitors went to my coach, said, "Hey, your athlete is not extending the spine." So the famous arch. So I have thoracic spondylosis. This is from decades of leading over patients with the a leaded vest and working, and plus genetics. But during a bench press, the thoracic spine, not the lumbar spine, but the thoracic spine needs to be arched in extension as far as possible. And the cue should be to pull in your shoulder blades, your scapula, down and in, or down and medial. And when you're laying in a supine position, as you're getting set and you're holding the bar here, so you're holding the bar here, so you need to pull the scapula down and in. And one of the cues people will talk about in beginning athletes, pretend the bar is like a piece of wood. So you're trying to bend the bar down. Of course, we can't bend a solid steel bar, but the motion cues to pull the scapula downwards and inwards before and also during the entirety of the lift. What does that do? It essentially takes the shoulder, it stabilizes the shoulder joint, the glenohumeral joint, because without it, the shoulder joint becomes external rotation and flex, and then you get this, and then the supraspinatus tendon is the first one, will tear away from the humerus. And so what I was doing is I was bracing like this, and I was coming down like that, and I wasn't pulling in or thoracically extending my spine. Now that looks very similar, but when I do that, that protects, it tucks in the glenohumeral joint that protects it. And I didn't know that. And I mean, even my coach who was coaching me knew that, but it's so subtle, it's very difficult to see unless you're under the tutelage of someone that is and my coach is an expert, but I wasn't doing it well enough. And then I injured myself about 1.5 years, 2 years ago. And it's been, I'm still competing through it, but it's been a persistent problem. So it's very subtle things. In CrossFit, when you do these rapid exercises, it's fast. I see them do, like, for instance, pull-ups so fast. It looks like some kind of engine cam. There's no possible way that a human being can perform those movements under heavy weights with correct technique. I will state for the record, it is impossible. Injury results.
Fair enough. Very logical thesis.
Yeah.
So for someone then, if they're in their 40s, 50s, and 60s, and you had to carve out perfect exercise routine for longevity,
yep,
how would you build that?
Well, of course, where it depends. I'm going to have to qualify a little bit. Depends on where someone's starting from. So let's just take when I say semi-average patient. Someone comes in, and whether it be a spinal, most pain specialists, the majority of work what we see is spine, low back pain, stenosis, neck pain, headache. That's probably the majority of what I see. Although like you, I'm sure everything else in between. But even irrespective of their age, first of all, baseline, where are they at? And so when they come in, we'll observe them, we examine them, and they cannot, let's say it's stenosis, they cannot stand for more than 3 minutes of a neurogenic claudication. They're not an operative candidate. And so there's no evidence or there's minimal risk of any, injury to the cord or the nerve roots, but there's a lot of pain. We do these things. And so I'll work with the therapist, and I have a few therapists that are very, very good at both advanced sports training. There's one in town who Olympic athletes happen to fly in to see this gentleman. And I'll ask him, and I'll ask the patient, what do you want to do? In other words, what can you not do? And we ask this as pain specialists all the time. What functional impairments do you have? I have to call my husband to pull me off the commode, or et cetera, et cetera. All right. Well, that's hip flexor stiffness or tightness combined with extensor weakness. And so I first identify that. So what will I do? I don't even mention weights at all to a patient because it's entirely body weight type of movements. So, and there's no equipment needed. And I will demonstrate, and I'll say with somebody. So I'll never have the patient. I don't believe in ever handing an exercise sheet to a patient. Because I know there's a good chance they'll either be doing it incorrectly or perhaps injuring themselves or both. But I will demonstrate to a patient, depending on that, first just body weight movements. As simple as, let me see you squat. Let me see you just body weight. You have to let me see you pick. I just put a pencil on the floor, and if a patient can't do that, then we start even further back than that. But I have, let's say, a 62 or a 68-year-old, a male or female, severe back pain, probably stenotic, maybe arthropathic, maybe both, arthritis and stenosis. Pick that pencil up. And so they say, oh, I know, doctor, I'm supposed to use my knees. I know that. And so they'll bend their knees and they'll come down. And they'll, almost get it. Oh, yeah, that hurts. And so I'll start with just even supported squat therapy. So just even a ball, a Swiss ball, or just a smooth part of their wall at home, and just get them leaning against that wall to get those the hip flexor extensors, not only the muscles, but I can tell you, their tendons and their support structures are so tight, they probably haven't bent or squatted in 3-4 decades correctly. So it's just body weight. But I'll get them to do these things. Or for instance, upper extremity, whether it be cervical or anything, I will have them get a can of beans or a can of beans or a can of fruit. And then we'll first get them just to overhead. I'll teach them basic type of exercise, very slow. Of overhead, this would be a dumbbell military press. And what does that do? And I'll correct them. All right, now I want you to think pulling in your shoulder blades when you're lifting up. And so I will have the patient start where they are. And a lot of them, as you know, are very debilitated. But those that are willing to meet me more than halfway, because some patients, as you know, just fix me, doc. And then I can't help that. I mean, I will spend the effort, but unless they do some of these things, I tell them that you're just going to you've got 1 foot in the grave, and you're going to better, if not 2. And so a lot of them start doing that. And then the next phase is then with weights, and then the next phase with increasing amounts of weights. And so I find it to be very helpful. Honestly, how many percentage of patients do this? Not many. Just being open, not many.
So let's say you have someone, let's say you have me, someone like me. So someone in their 40s, 50s, yep, reasonably in shape, but they want to be able to say bench something close. I'm not going to say what you do.
Body.
Yeah, like do the bench their body weight, squat a reasonable amount, deadlift a reasonable amount. How would they go about getting to that next level?
Yeah.
Now you're going from average. Say they want to go from average to high functioning.
Good. So average, like the weekend warrior athlete. Like I'll see a lot of patients like you know what? They're not crippled like a lot of patients we see who have usually, as you know, those patients get that bad. Sometimes it was no choice. It wasn't a choice, but it's a lifestyle issue. So that is choice. But someone, a common patient, the construction worker, or the business executive who just put their career first, and they work out and they play in the softball league or whatever, but they're having more and more aches and pains. So what first of all I do is, can they even whether it be through a good therapist, but therapists don't do this type of training, can they afford at least a few visits with a certified strength trainer? The reason I mention that, and if they can't, then they can. I'll tell you what I do after that. But a certified strength trainer, there's a lot of people that have certificates that they get off maybe a legitimate course or not. But a certified strength trainer will know, first of all, with an assessment, like we do an assessment, where these patients are. And it's generally, where are you too tight and where are you too weak?
So when you say certified, there are a lot of certification bodies.
Yeah.
Which certification are you looking for?
I'm not trying to avoid that, but there's several of them out there that are very good. But and I'm not going to say the ones very bad. Just don't want to get in trouble.
How about just like for anyone listening, that way they know like the several that are good.
Yeah, like the American Academy of Sports Medicine has a subdivision of certified strength and conditioning. The American strength and conditioning. forgive me, but anything that is nationally certified under
What certified?
yes, it's not, it's like our equivalent of board certification, and it's a test that they take, the American Academy of Strength and Conditioning, and there's a couple other ones, but again, I would recommend that they're nationally accredited, and then just ask that person, what are your credentials? And if it is a credential that has, American, and if it's an academy it's probably legit. If it is the, I'll just give an example of something in our specialty, like the Pain Management Council accreditation or something like that. They took not even a weekend course or on the internet. That's just not going to suffice. But the American Academy of Strength Conditioning or Strength and Conditioning coaches, these are the people that can be found. And again, internet, they can be found with that. But I would tend to ask the patient's physical therapist, because they either have one at their office, almost always, and if they don't, they know of one. So the best source is not the internet, as I was saying, got to be careful with that, but would be with the patient's physical therapist, because I almost always will have a patient, we have to have them try therapy, or if they've tried it, or if they're in it, I'll ask. But I happen to know here a few sources, but ask your therapist, or if you don't have a physical therapist, ask your doctor to get you to a therapist, to ask, do you have, or are you certified? Because as a physical therapist, they have to be certified by a nationally ordained board. But ask them that, and they'll have the most physical therapists, physical therapy franchises or offices will either have one on staff. If they don't, they will know. I would start there. The reason being is that this commitment to go into something weekend warrior, like, you know what, I want to really get in shape. I want to be able to lift and bench more than my body weight. I want to be able to squat. The ratio, as we were talking earlier, is 3, 4, 5. That would be a perfect ratio of 300-pound bench, 400-pound squat, 500-pound deadlift. Now that is you do that, you're doing really well. Any grown male or females, that ratio stays true. Now mine is not that. I'm more like a 3, 4, 4. My squat, although I feel like it's strong, but it's probably because I have had ruptured discs in the past, and it's more of a psychological thing. I mean, squats are good for your back. Squats are good for your knees done correctly. So is deadlift. Deadlifting, it looks like it would be horrific with low back. It is done incorrectly. I mean, a moment lapse.
Just to put out those numbers, because we were discussing this later, as a benchmark. So you're 59.
Yep.
And then what is your bench, deadlift, and squat?
Yep. Currently, my official, when everybody says, "Oh, my benches," because this is what the question they were talking earlier. Hey, what do you bench, dude? There's the bench that is done in the gym or local Planet Fitness or whatever, but the official bench, which is a 3 judges watching you, where there is an intentional pause at the top. The command is given to lower the bar. The bar has to be on the chest and motionless for, it can be up to a second or 2, but for a time that you're not moving it, but you're just barely touching the chest, and then a full press upwards till your arms are again fully extended. And then once that is motionless for about a second, then the command to rack it. So there's 4 segments to that. And the reason I bring that out is that is a lot different than someone loading a lot of weight on after the warm up and going, okay, and heaving it in, and because you're heaving it or you're rebounding it off the belly or the chest. But a official competitive squat under those rules, keeping the rear end in contact with the bench, keeping the shoulder blades in contact, not moving your feet, et cetera, et cetera. My bench right now is record for Michigan in my age weight group is 155 kilos, which is 342 pounds. So that holds the state record in the 55 to 59 age group in my weight, because my weight is below 220, below 100 kilos or 220 pounds, but above 90 kilos. So between 198 to 222 is my weight class. And so that is, in my state of Michigan, that is the first and highest record right now.
And then when did you start lifting? When did you get serious about powerlifting? How old were you?
Well, competitive powerlifting, I started competing only about serious competing 4 or 5 years ago.
But when did you actually start lifting?
I started lifting at least 23 or 24 years ago. So it might even be 25. Actually, you know what? It was 1998. I remember my wife at that time, I've been remarried, my wife at that time, this is going to be silly, but we watched the movie, it was Terminator 2. And my wife commented when the actress Linda Hamilton, when she was in that psychiatric institute doing those pull-ups, she was really, we couldn't believe how much shape she got. And my wife says, that's what I would like to look like. And I said, yeah, that would be pretty cool. And I looked down, and I had about a 38-inch waist. And I wasn't overweight. Well, I was overweight, but I wasn't obese. But I didn't look or feel that great. And so that was 1998. So I hired a strength coach, but it wasn't for powerlifting. It was just, I couldn't do one pull up of my own body weight. I couldn't bench 135 pounds. That's just a pair of 45s and a 45-pound bar. And I wasn't weak. I was in good shape cardiovascularly, but I couldn't do anything. So I've been doing this for 27 or whatever it is since 1998 years, but I've been seriously competing for the past 4 or 5 in federated or federation competitions. But my best bench press was about in 2014. But again, that was in it was a sanctioned meet, but it wasn't a federation meet. It was 415 pounds. But again, that was about 9 years ago. But whether that would have been official or not, or it had been flagged as up, you move this, you move that. My theory is it might have been flagged as a poor lift, but I did lift that. But in competition, they're very strict rules, but that's great because it tries to compare apples to apples. So when you know that you've competed in a federation, judge, very strict level of judging, they have to be certified, you know that that person did legitimately lift that weight. It doesn't mean that everybody has to do that, but I find that it has absolutely changed my physique. It's absolutely changed even my mentation, my activity, my thought processes. I run circles around my other colleagues that are literally half my age. And I don't mean to be denigrating, but they're like, I'm wiped out. And I'm tired too, but it's just, I'm coming up on 60. And, there's physicians that are 38 and they're exhausted. And I tell them.
So the question I know that people will want me to ask listening to this podcast is your thought, first, are you on hormone replacement? And then what are your thoughts on hormone replacement?
Well, I'm first of all very much in favor of hormone replacement, and so much so that I am likely headed that way. But no, my entire life up to now has been, we call it raw, which just means
okay.
It's called raw. Yeah, the colloquial terms are you raw, or are you natural, or are you geared? And but no, my own numbers are, because my doctor treats them and they're coming down, and yeah, I'm gonna investigate that, but I am in favor of it. The reason being is that age, as I believe, and also the American Academy of Age Management, age by definition, aging is technically a disease. It's cellular dysfunction. Now it's due to the telomeres and at the DNA level getting less and less, are starting to die off. But to do what we can do, to whether it be hormone replacement therapy in males, whether that be testosterone replacement in females, testosterone as well, and other hormonal and other supplement therapies, I am a 0 to 10 out of 10, I'm a 10 advocate for it. There's the slippery slope, though, when you go into super physiological levels, like the abuse of those drugs, for whether it be typically bodybuilding, because again, we were speaking beforehand, there's been a couple of different studies looking at, because there's 2 divisions, tested and non-tested in most federations, not all, and tested being urine samples afterwards for the certain percentage of the winners. And if you test positive for substances, or your ratios of estradiol, testosterone are more than a certain ratio, then you are banned for life from that federation. But there are also, we call non-tested, which it doesn't mean you have to be on HRT hormones, but if you are, it's just fine. And so they've studied the two groups of the results. And while there is a definite association, mostly with weight, body weight, a 350-pound man will be able to lift more than a 215-pound man. I don't care how much or little each other lifts. There are extremes. There are men that are 350 pounds that I treat that I can bench press out, no problem. I can beat them any day. But competitors, weight is a big thing, and age is the second column. And even though I have beat in the open division, just on weight class only, I have won those divisions in regional meets, and nationally, I've come in second once. Open category, just my weight only, happened to be the second highest number in the bench. But people with HRT, there doesn't seem to be that much of a difference in actual strength at a competitive level. But what is the difference is things like bodybuilding, the super hypertrophic changes. You know, if you see someone like these pictures where they're just brimming with like muscle upon muscle upon muscle, that patient is not, or that person is not natural. I mean, it's an impossibility.
So because you're a busy pain physician, you have kids, you're married. What does your workout look like on an average week? And then if you give us a tour of your gym, that'd be great. And
Sure.
what you do with all that equipment. That's a lot of equipment.
Yeah, it is a lot of equipment. So I'll just unclip this real quick, try to hold it as steady as I can. So what a person would need, if someone said, you know what, I want to get into it. And I get this question a lot. Doc, I mean, I'm not going to buy out a whole gym, but what do I need? What's the absolutely essential? And it's not as much as you think, and I'll show you what I have. So one thing, if you had the room, you need essentially a squat rack, and this is a squat rack. It's looks like a rectangular metal, thick metal based cage. And that has safeties on it so that if I'm, let's say I was doing incline benches the other day, and if it get it set, we don't have to worry about, since I'm working alone, that I picked a weight that is too heavy for me, or something happens and slips, I'm not killed, because if a 300-400 plus pound weight comes down on if a 45-pound bar, empty bar, comes down on your trachea, that's it. I mean, you'll probably be killed, if not mortally injured. But even if a 300 or 400-pound weight comes and hits you on the chest and you can't get from underneath it, you're in trouble. So squat racks are great, not only for safety, they're a requirement, but for also the variety of things you can do. We can do pull-ups, we can do various benches. So you need the squat rack, a bench, and just your basic amount of weights. I have some standard poundage weights. These happen to be rubber coated, or I have certified, and I went this because these are exactly what they weigh. These are certified and precise within 10 grams, as in, they're super, this is what in the Olympics and that type of thing, that the people are lifting exactly what they say they're lifting. So that, and they'll have certain stickers on this. So a bar, obviously a bench, and a squat cage. The other way to go is with dumbbells. And so there's various different types of systems out there, which if you don't have a lot of space, there's what they call selectorized dumbbells, where you slide them in and they get heavier and heavier depending, and it's a small little unit. But I have, a set of dumbbells here from what I call 3 or 5 pounds up to a pair of 100 pounds, in typically lower, anywhere from 3 to typically 5 pound increments as they go up. But so I have 2 squat cages. One, I principally do my deadlifts and some incline work, and the other one where I have it's set up to do my major bench pressing, but you can do anything in here. However, A lot of this is I don't have people handing off to me, because remember I said when you're bench pressing, you want somebody to hand off to you because you want to keep your scapula tucked in. And so these are just self-loading so that I don't have to have someone here to spot me. So this allows me to keep my form correct when I'm doing heavy weights. And then this is a massager for my shoulder. But these types of a squat rack and a bench, I have two of them. This is called a pit shark. This is a great device for someone that has had a bad back but still wants to be able to lift and develop everything from their posterior chain, from half their body down. And you just get in here and you'll put on a belt and you'll put that in there, and then you'll literally just squat down, but you'll have a belt connected to the actual machine, and it decompresses the spine while you're still loading. You're squatting by decompressing your spine at the same time. It's actually invented by a fellow here in Michigan. I can't give him credit. I don't remember his name, but it's called this machine is patented. It allows you to do belt squats, which for patients with spinal stenosis or that cannot afford to load their spine, or disc herniation even more so, but they need to develop their entire lower chain. This actually improves by it provides traction to the spine, and at the same time loads your quadriceps, your erector spinae at the same time. It's a brilliant piece of equipment. And then the other one I'd recommend is it's called a reverse hyper machine, which is you get on here and then you lay across this area and you're performing extensions or backward lifts of the leg, and that really strengthens the entire low back, what they call a posterior chain, from about the mid-thoracics in between your shoulder blades all the way down the entire back side, from your buttocks, your hamstrings, you name it, whilst again providing a decompressive force to the discs. I got this when I was having disc issues in my low back, and this actually helped me rehab my persistent disc bulges and still not only just maintain strength, but I use this as part of my deadlift training. And then various other apparatuses, you can do different exercises, but this is primarily for extension exercises of the mid, low back, and buttocks and legs. This is for people that want to do deadlifting. This is an open bar. This allows training for the deadlift, and deadlifting just means I'm going to pick something up off the ground without hurting my back. And deadlifting is the lifting of very heavy weights, a bar from the floor until you're fully stood up and erect. And these techniques and this type of equipment allows myself to compete, but also allows people to be able to lift up that UPS box that weighs maybe 50 pounds without blowing out their disc again. And so it's just...
I have a little bit of a technical question. What are your thoughts on a regular bar versus a trap bar for deadlifts?
They are both indispensable. The trap bar or open bar, this one, I just give a shout out to Leico, which is a Swedish company. It's phenomenal, but there's about probably 10 different companies that make these. A trap bar will allow you to keep the center of gravity. Okay, let me see if I can get this or not.
So wait, let me just jump in. So for anyone who doesn't know, so you can deadlift with a straight bar, or you can deadlift with like this hexagon type bar that looks like that.
A bar like this. This could be, let's say, on the ground. It'll have the weights on it. It'll be resting on the ground, and you basically just, all right, put your legs out, and you just bend over and you pick it up with your arms locked straight. You just pick something off the floor. However, that requires precise techniques, because the moment, if I were to, I want to see if I can see this, the moment, let me get closer to the mirror. So if I am bending over, and I'm to bend over to do to pick up something on the floor, and then in my low back, if I start to lordose, or if I start to bend forward in my low back, I start to lift something up, that's almost a guaranteed disc rupture if you have disc issues, but it's also just bad lifting form. So you want to make sure when you bend over that you maintain a really good lordosis while you lift up something heavy. The trap bar, because the path of the loading is more here and to equal to the hips versus in front of you, it allows the vector of force to be in line with your center of gravity versus in front of your center of gravity. So for beginners or for people rehabbing from a back injury, the trap bar is just an absolute blessing, because it allows you to lift and still train the exact same muscles. The trap bar does train the quadriceps a little bit more than the rector spinae, but it'll still train both. But it's more forgiving, and I'd recommend first starting with the trap bar for people learning the deadlift, and then still maintaining it, using it, because it does isolate the quadriceps or the thigh muscles better, as opposed to the standard just deadlifting straight bar. When you pull that up, it will engage the quads, but it'll engage your back muscles a lot more, as opposed to the trap bar, which engages your quad muscles more. So I guess I'll say it's safer for the back, especially if you're a beginner and or if you're just rehabbing from an injury, if that makes sense.
So what does your workout routine look like for a week? I mean, you're a busy physician, you have kids, you have a wife, you have things to do.
Yep.
Like, how many times a week are you working out, and how much time are you putting in?
That's a great question. It's actually a lot less time that you'd think. I work out. I have 3 workouts a week, and they're basically, if I'm in here longer than an hour, I'm reading too many emails or checking my Instagram account too often. So it's an hour, 3 times a week. So 3 hours a week. That's all I do. And I'll come in and I'll set it up, and I have my little book here, and I just record what I've been doing, and each day, who it's with, what time, what I did. So I will divide things up into push, pull. So that means doesn't always mean a barbell or bench press, but anything that involves pushing. So can be pushing up like a military press, bench press, incline bench press, et cetera, pulling, because for every amount of exercise that you push, you need to develop the extensor or the pulls equally. Your back, to be able to push a lot, you have to be able to pull the same amount, because you can't, as we said, to stabilize pushing, you have to have the equal and opposite. You have to have the extensors or the back muscles as strong. So if I'm doing typically in an hour, between 14, if I'm doing very heavy weights, 14 sets. If I'm doing moderate weights, up to 20 to 22, maybe even 24 sets if it's lighter weight. So the average person of moderate weight, 18 to 20 sets, takes about 1 hour with not too much rest, but not too little rest. And the average, let's say if you do a set of, let's say 10, again, when I'm starting to prep for weights, for weight competition, I'm getting down into training singles and double lifts, maybe triples, or 3 repetitions of a certain heavy weight, and then 2, and then 1. There's more rest in between because I'm going for that. But I come in, it's about an hour, and it depends between 14 sets, let's say 6 sets of bench press after I warm up with some push-ups or stretches, 6 to 8 sets of bench press, moderately heavy to heavy. And then I'll do a bunch of, 6 to 8 sets of, let's say, pull-ups. Or I like to, again, whether it be low back landmine, where I'm pulling this, like just pulling it, back muscles, pulling this with a cable machine, or another cable machine I have is over here. This is more of a rehab machine, but still it can be a variety of different angles where you can pull a lot of different things. And so 1 hour, 14 to 22 sets of work, 3 days a week, push pulls 1 day a week. And then lower extremity, which means typically either deadlifting exercises or accessory exercises, things that I'm lifting up off the ground, trap bar, the pit shark I showed you, the reverse hyper machine. And then I will do a third day where I will do a little bit of endurance mixed with strength. For instance, rowing. I've got a rower here. I highly recommend that. What am I doing? It's an endurance activity that still allows me to work on my pulling and my back, which is incredibly important, back muscles, but also abdominal exercises, like roller machines. You've seen these where you just get down and put your knees here and you extend out for core strengthening. So my third day is core strengthening, whether it be semi-endurance or abdominal and pelvic core strength exercises, push, pull, and then squat, deadlift. So three workouts a week. That's it.
So 3 hours a week. That's I appreciate you sharing the workout philosophy, because I think everyone knows of people who go to, say, a commercial gym and they spend an hour on a treadmill or an hour on an elliptical, and they're doing that every day, and then nothing changes, and they haven't really lost any weight, they haven't put on any strength. It's kind of a not efficient way to
It's so, and I can so understand that frustration, because that's a lot of time, and it's hard to lose weight. And if, like, for people that might be watching this saying, you know what, I don't want to compete. Yeah, I want to get in better shape. I just want to lose this. I mean, I look terrible. I mean, summer's coming up in 5 months, whatever. I just want to get toned. And this is what I hear a lot of time from people. I just want to get toned. I don't want to look all jacked up and things like that. I just want to get toned. Okay, you're not going to do it on a Stairmaster or an elliptical. I mean, it's better than nothing. So I'll say that. But the key is our muscles and our neurologic system get used to a stress within, of 2 to 3 a week. Within 6 weeks, you've got to change it up every 6 weeks. The specific adaptation principle is just, whatever you're doing, you have to either do something that's heavier, do something that's faster, and it's like endurance athletes, or a combination of, or change it up. And this is why changing techniques, whether I work with like dumbbells, when I'm bench pressing with dumbbells, it's a totally different workout. I'll actually sometimes get sore from that with much lower weight, and I'm not with other areas or barbell lifting. So for those people who I just want to get toned, again, the endurance is very important. So I'll jump on the rower, I'll jump on the treadmill for a little bit. Typically the row machine, I can't stay on the treadmill, but I will also increase the number of sets that I do. So instead of doing 6 sets at 315 or 325 pound bench, which would be as I'm getting closer to a meet prep or peaking for that, but in between, and I'm giving my body, quote, rest, I'm going to be doing, 10 sets of different types of push-pull at 50, 60, 70% of my maximum. And this is a technique of training where if your maximum lift is, let's say, just to make the math easy, let's say 300 pounds is the most I could bench press. So then 75% of that. So, 10, 30, 60, 90, so like 100 pounds less than that. So 200 pound bench presses, but instead of doing it for single or doubles, doing it for 8 to 10 reps, that type of thing. So again, mixing that up. It's otherwise you're going to get stale, you're going to get injured, and you're going to get nowhere.
And what does your nutrition look like?
Bad. I know it's not bad. I joke with that. It is clean. I use a lot. When I say I don't use really many supplements. I do use a supplement when I'm working out. It increases glucose, but with starches, so you don't get a flood of insulin. But if you want to do that, I typically stick to a gram of protein per body weight per day. So that's for me, let's just round it off. Let's say 200 pounds, I weigh approximately. So 200 grams of protein per day, which is, it's a lot. But whether that be, if you're a vegan, you're just going to have to use those type of soy.
To get that much protein, I'm assuming you're supplementing with protein shakes or protein bars. That's a lot of protein.
Yeah, it is. I am. And typically, I'm going to tell you, I don't get sponsored by anybody like that, so I have no financial disclosures at all with this. But everybody laughs because I show up to the meets with this, and it's appropriate. They laugh because I'm older competitor. They don't laugh at that, but they laugh. I'll grab an Ensure Plus, and those have 350 grams. I'm sorry, those have 40. They have a lot. It's significant, almost 40 grams of protein in 8 milliliters, and it's 350 calories. I'm not looking to cut back calories because, if anything, I don't eat enough. It's as a power lifter, and my body fat is like 7.5%, and I'm proud of that, but it doesn't help me in powerlifting. And if you look at the power athletes, they're bigger men and women. They're bigger. They're not, there's an old saying, kind of fat, but definitely fit. But again, for patients that want to get that shredded appearance, still protein is necessary. So you're going to have to supplement. And so I'll eat in the morning, I'll eat some eggs. I'll eat typically 2 to 5 eggs There's preparations that I make because I'm busy. So I'll buy these Jimmy Dean's ready-made thing. Got the eggs, got the sausage, the bacon, and in the microwave for 55 seconds. And I can get between 300 to 600 calories, most of it protein and healthy fat, really quick. And as I'm rushing off to the clinic and I'm running late, and then I'll do that, and I'll do the Ensure Plus during the day. And I'll do more, again, natural proteins, whether it be the chickens, the beef, sausages. I'm a red meat kind of guy. And then at dinner, the same thing. But I do supplement with those shakes. One bottle, it's only 350 mils, so it's not very much. I'm sorry, 8 ounces, that's about the same, but it's not very much. But those are 350 calories and about 40 grams of protein per. So those alone, put me over that. I might be misquoting the protein, but either way, 200 grams of protein or 1 gram of protein per pound of body weight per day. And then the rest of it, it's almost a zone diet.
Are you tracking like water or vegetables or anything else you track?
I don't track it, but it's absolutely a must. And I don't drink enough water. I'm just being fully transparent in the whole interview. They talk about 8 to 10 ounce glasses of water. I should do that. I don't. And that would definitely help me. But that is important. I don't track vegetables, but I use the vegetables as just ways to get down protein more palatably. And so I definitely eat plenty of vegetables. I love them. But when I'm doing a famous recipe that I have that my coach gave me, he says, take a bunch of rice and then whatever green vegetable you want, whether it be broccoli, whatever, and put a bunch of lean or fatty ground beef in there, stir it up, whatever things that you want for seasoning, and I'll try to eat as much of that.
Oh, good. I thought you were going to say blend it.
No, I know.
I thought you were going to say blend it and drink it. I was like, I can't do that.
Yeah, no, I can't do that. I can't handle that. But there's
can't do
people that do that. But yeah. So it's imperative that if you want to, again, and this is the other thing, well, I don't want to get big. I don't want to get fat. You're at 3 hours a week doing this. Remember, muscle burns calories when you're sleeping. Our basal metabolic rate, or BMR, goes up it just takes more calories to keep those cells alive versus completely endurance. Again, you're burning calories and your metabolic rate does go up for hours after that. But when you are at, when you have muscle mass of, let's say, my muscle mass probably for 215 pounds is about 115 to 120 pounds of pure muscle, according to the read, then it takes a lot more calories just for me to breathe and to stay alive than if I was same weight, but with less muscle mass. And so you would have to diet. You do have to dial that in. But with this, the advantage of the power of weight training is that you don't have to restrict your calories as much because you need your body to fuel. That's where you get stronger. Because otherwise, what is training? Training is purposeful micro tearing of fibers to lay down the hypertrophic response. So if you're not eating, and this is my problem I suffer from, if you're not eating enough, you're not going to make gains. You're not going to get stronger. In fact, you'll get injured.
Great thought. I really appreciate your time for this podcast. Any closing thoughts for anyone listening, or anything I should have asked that, or you want people to ask you that they haven't, or I haven't asked you?
The one thing that is, a lot of patients will ask me, like the doctor, how do you do it? That type of thing. I can't do this. I can't. There's no way I could do that. Yeah, that's because you were doing that. That's because you're doing that. But it doesn't matter where people start at. But I do tell patients, and this is kind of morbid, but I think I said it before, is that if you, John Q. Public, do not stress yourself. And when I say there's good stresses or bad stresses, but again, stress yourself physically and or even emotionally and spiritually, etc., you're just going to get weaker, and life will be more difficult. And when you say you get older, I've seen people that are 20, 30 years younger than mine, and you see them every day in the clinic that are just, I do feel bad. I tell them this is what, not necessarily even weight training, you need to move. So you need to move it and literally lose it. What I mean, lose the quality of your life. It's just I know it sounds preachy, sounds cliche, but that's what I really try to push with.
Perfect. Dr. Javery, thank you so much. In the show notes, we'll have contact information for your clinic if anyone has a chronic pain issue, because of course you're paid physician but I like that you take a holistic approach as opposed to just throwing medications at people.
Definitely. I do what I can. Hey,
Perfect.
thank you. Yes,
Thank you so much.
Thank you.
Thank you for listening. If you enjoyed this podcast, please subscribe and visit the Get Healthy 360 Facebook page. We are always looking for feedback and new story ideas. Thanks again, and see you next time.